House Call. Our hosts today are Dr. Kevin Agnew and Joe Bonner. Dr. Richard Jensen is also a certified acupuncturist in practice in Minnesota.
Welcome to House Call. I'm Dr. Gerald Lala.
And I'm Dr. Richard Jensen.
Wonderful to have you with us today. If you're not from Minnesota, some other part of the United States, or from some other country on the globe, Shoreview, Minnesota is the gateway to the north coast of the United States. And that's the beautiful area of Lake Superior, the north coast of the United States. And we have many programs. We play all the way up through the north coast of Minnesota into St. Louis County and into Wisconsin, so we welcome those viewers up there too. Dr. Jensen is going to begin by discussing chronic fatigue syndrome, and a lot of people have this. Sometimes it's been misdiagnosed, sometimes not diagnosed at all. So what are some of the symptoms of chronic fatigue syndrome, Doctor?
Thank you, Dr. Lala. Symptoms of chronic fatigue syndrome start with a persistent and debilitating fatigue that they have. They have an inability to get up and go without forcing themselves to do so. So it's kind of, get me up out of the chair and get moving. It has repeated sore throat, swollen lymph glands that happen in there that continue on for long periods of time. They also will have some of the symptoms of fibromyalgia, arthralgia, which is swelling within the joints. It's not necessarily saying that they have arthritis yet, but arthralgia can certainly lead to arthritis. They'll have mood swings as well, and also due to being as uncomfortable as they can, as this can make them, that they can also suffer from insomnia. Some possible causes of chronic fatigue syndrome can be due to viruses such as the Epstein-Barr virus. It can also be caused by intestinal parasites, and we're talking about bacteria, viruses, protozoa, Clostridia, those kinds of things that can occur in there. It can also have a compromised immune system. And now these are not all mutually exclusive of each other. You might have a number of these things going on at the same time. So a compromised immune system, blood deficiencies going on, such as some anemias, food allergies that are taking place that can bring you soreness within the joints also, as well as working through you in a systemic way. Back problems where you're having fatigue in the back, quite generally along the lower back, but certainly can manifest anywhere in the back also. Now, diagnosis of chronic fatigue syndrome relies quite heavily on Dr. Lala?
Diagnosis certainly begins with taking a comprehensive case history. Many times in this rapid running patients through, like hooking a hog on a hook and running it through the meat factory, often the history is neglected. And certainly the history would be, is there a history of back problems? If that's the case, we need a good spinal examination, a good neurological postural workup. If it's a possible intestinal issue, such as parasites, then there are urine tests that we can run to check for metabolic markers that might indicate the manifestation of bacteria, viruses, protozoa, or Clostridia. If food allergies, there are different food allergy tests that can be performed, which would also help in the diagnosis. And blood deficiencies, of course, by doing certain blood tests would tell us if it might be related to that. Another possible cause is in imbalances or deficiencies of neurotransmitters. What are neurotransmitters? Neurotransmitters are natural chemicals found in our brain and our nervous systems that are designed to facilitate and regulate the function of and transmission of the electrical energy between our brain and nervous systems. Now, there are two varieties of them, or two classifications. One is excitatory neurotransmitters. They accelerate accelerate nerve and chemical reactions in the brain, nerves and organs. And some of the most common ones that I'm sure most of you have heard about are dopamine, epinephrine, and norepinephrine. Then there are what we call the sex hormones play a significant role in people who have fibromyalgia or chronic fatigue syndrome, and those are usually diagnosed through a 24-hour hormone analysis. It's usually the easiest and least expensive and most comprehensive way of doing that, in my opinion, is through collecting of the urine over a 24-hour period. And the particular hormones that are usually imbalanced, excessive, or deficient are estrogen, estradiol, progesterone, and ethylcholinine. And then the others that are usually involved are testosterone, androsterone, and some other what we refer to as adrenocortical steroid hormones. Now, Dr. Jensen is going to talk about you can do these tests, but very often traditional or orthodox medicine does everything from a clinical perspective, and he's going to discuss the difference between a clinical evaluation as well as a homeostatic evaluation.
Right. Thank you, Dr. Lala. Well, when you look at a clinical manifestation of things, doctors in their infinite wisdom of trying to find out how to look at some of these diseases, and diseases are basically a clumping together of symptoms that commonly occur together, and that is what becomes a disease. And so they looked at the blood levels of certain things within the blood, and we call those blood panels. And when they did this, they looked at people within the hospitals. Well, what do we know about people in the hospitals? That generally, people are in the hospital when they're sick. And so what they found is when levels of certain substances in the blood reached a high point, or over that high point, they manifested these clinical symptoms of these particular diseases. When it was below a certain point, they manifested clinical symptoms of these particular diseases. So then what happened is later we tested a population of healthy people to see what the optimal ranges of these particular blood byproducts or what have you would be. And so that was a much narrower area, and sometimes it's narrower up towards the top, sometimes it's narrower towards the bottom. It's not just saying, hey, let's subtract 20% from the top and 20% from the bottom and say, there it is. It's an actual range that was tested to find these things. And what we find is when somebody goes above this, and we call this a homeostatic range, when somebody goes above this, they may be starting to trend towards this clinical manifestation. And so we want to catch them in this in-between part. So as to prevent the disease. It's always easier to prevent a particular disease process earlier on than it is later. So that's what we want to try to find. And so we look at that the health is in the blood, and by taking the blood and looking at all these different areas of that and how it all works together synergistically, that we can then treat it and give you the necessary things that you need to heal the best as you can. So then also there's another thing called organic acids, and we run an organic acid analysis. And as Dr. Lala was talking about, that many times we are subject to other parasites such as bacteria, protozoa, yeast, and fungal infections. Some things like Clostridia and so forth that are found in there, or viruses. Some of these other organisms like this, they're too small to handle their own biological byproducts, their own free radicals, should we say. And so what they do is they just give them up to their environment. They excrete them out, and it just so happens to be that you are their environment. And so now you have to handle some of their byproducts, and many of those, such as in fungal infections, when they bloom, they create up to 70 neurotoxins. And so you try to think clearly through that. But you're also working with their free radicals, which free radicals can cause cancer. And in fact, they know of some oncoviruses that are out there that do cause cancer. such as human papillomavirus, which we've just heard a great deal about for cervical cancer. So there's an example for you. Organic acid analysis checks these organic acids through the bloodstream, or actually through urine, and sees how they've been metabolized by your body and excreted. And therefore, we can tell if they are over certain levels, whether you have these things within you, different things that need to be handled in different ways. And therefore, by knowing what's wrong, you can tailor the treatment to each person individually, not just looking at them, taking a cookbook type of way and saying, oh, you have these symptoms? Oh, this seems to be what's right for you. No, let's look at what's going on with you and get to the basic problem of it. We also go through and we take a look at what your posture might be like. And so if we bring up this slide, there's a good illustration of posture where we look at, say on the left side of the screen where we have the man facing you, he has this line. We'll call that a plumb bob or a gravity line, showing the distribution of his weight or mass as well as his posture upon it. And you have to see the line how it bisects through the forehead, through the nose, through the chin, through the middle part of the chest there, straight through the middle of the abdomen, going through the umbilicus or belly button, separating between the two legs, and should be halfway in between the 2 feet. As you can see, he's pulled a little bit over towards his right, our left, in this case. Then we can also look at from the back side, as we can see how the two sides are equal on either side of that plumb bob or gravity line, where it comes down straight between the shoulders and the shoulder blades, down through the middle of the back and the sacrum or tailbone, and ending up between the two heels, halfway in between there of his feet. Then we see from the side this weight line or gravity line or plumb bob, if you will, goes straight through the opening to the ear, through the point of the shoulder, right at the acromioclavicular joint for you doctors out there or students of anatomy. Should be going through the head of the femur or the hip joint there. Should go right behind the kneecap as we go down through the legs. And just forward from that lateral bone, that bone that's on the outside of your ankle, it should be just in front of that and almost to the front of the ankle. That shows you the right posture. Then we also have, here is that nervous system. The nervous system, as we see in the back and how posture can mediate that a great deal, goes to the different organs of the body. And what's important with this is with chronic fatigue syndrome, let's say there's a great deal of involvement, not only in the muscles, but also in the gastrointestinal tract. And so if we look at the gastrointestinal tract here, we have nerves that are coming out and going down to that gastrointestinal tract, primarily from the lumbar plexus, which is the lower third of the gastrointestinal tract, but all the way up from the top here, which comes all the way down and affects the stomach and the entire gastrointestinal tract down to the first 2/3 of the small intestine is controlled by up here. So this is a very important area to look for some pressure on the nervous system, as well as down here in the sacral base. And isn't it funny, when you look at posture in practice, we find that people who have an imbalance down here that affects all the way up due to gravity, having to deal with gravity affects everything all the way up into the neck. So you actually have to check both of these areas as a chiropractor and mediating through that nervous system. Also, these nerves, as we said earlier, affect all the joints and the peripherals and the muscles. And so by looking at that, we see that these nerves, they all come out. First of all, it comes from the brain, which is the, say, the generator for the whole body, the electrical generator. And it comes down and you have the switchboard. The switchboard where all these wires go off, or should we say telephone wires, if you will, go out. And as they do so, they clump in certain areas. And right here is the brachial plexus, and that that forms the nerve content to the upper extremity. And then when we look at that feeds the hand and the arms all the way up, and then we look at the lumbar plexus here, which looks at the genital urinary area. So it's affecting all your ways of waste as well as your reproductive organs through here. And then you have the sacral plexus, which affects the lower third of the digestive tract. Okay? It affects fight or flight. Actually, down here, we're finding that affects the relaxation of the body, whereas everything in between, here in the tail and here up here affects relaxation. Here in between affects fight or flight. So that becomes a real area for us to look at, for particularly when people are under chronic fatigue. They tend to be a little more susceptible to stress, and stress throws them into a fight or flight mode, making them more susceptible to that pain also. Then when we look at the gastrointestinal tract, when we look at the opening in the mouth, and it goes through the esophagus down to the stomach. As the stomach comes off the side going into the small intestine, we have all these other organs like the liver that secrete into it. The pancreas, which is not seen here, but it's underneath the stomach, behind the stomach, if you will, is secreting into there to change the pH and dumping enough chemicals in there. About a quart of chemicals is being dumped in here each day to deal with the foods, with changing the pH and giving us digestive enzymes for the correct digestion of all the foods, in which then a lot of all our minerals and things are absorbed through the first, say, 2 feet, and the rest through the rest of the small intestine. And by the time we get down to the large intestine, it's pretty much compacting the things and getting rid of the water, absorbing all the water that's extra there to come out and be reabsorbed by the body, as well as some of the nutrients. What we look here is at how the gastrointestinal tract is being made. It's a number of layers of this that have undulations in it. And these undulations, if you pulled those out so that the gastrointestinal tract was completely flat, it would be about the size of a tennis court. And if you look at it in these undulations, you have certain cell makeups here. And you can see all the cells together, and they have desmosomes in between them that seal up between these cells. These cells are called enterocytes, which are aptly named for this is how food enters into our body. And what happens is, in some of these food sensitivities, we'll have splits that occur in here due to swelling and other things that create holes between here, that food don't have to go through the enterocytes, but directly into the bloodstream. Here's a little bit more blown up version of the gastrointestinal tract. Here we see the stomach. See how the liver is connected into it and dumping things in. You see the pancreas over here. This is actually to the liver with the common bile duct. Many people out there have had gallstones, which are stones that form in here that can't pass through this, so they'll have had that removed and now no longer have a gallbladder. But what happens is this common bile duct, what happens here is that will actually hypertrophy over time and act as another gallbladder in its absence. But that dumps in, like I said, it was 1 quart of stuff a day that gets dumped into this small intestine as it travels through. Here's the small intestine again, and then as it empties into the cecal valve. Here's your appendix, and in fact they find the appendix is a place where our body naturally incubates some of the good bacteria that it needs through the intestinal tract. So that's actually an important organ. Then you have the ascending large intestine, or colon, the transverse colon, and the descending colon goes into the sigmoid colon, which is this S curve, and then into the anus, which is the end of this. As you can see, there's quite a lot of blood flow that goes to this entire system throughout here. And so then we want to look at subluxations, because each of these things can be affected by subluxations. And by doing that, it brings us back to the spine. And what we have are two vertebrae here that come through to the nervous. This is nervous tissue. This is actually a nerve, the spinal nerve, coming out through this tunnel here, which is called the intervertebral foramina. And you have a disc here, as well as a spinal cord here going through the spinal canal. And what we can have is, if this bone is pushed back on this, or this bone pushed back in relationship to this one, you can actually close off this intervertebral foramina and putting pressure on this nerve, as well as the arteries and veins, lymphatics, and acupuncture meridians that pass through here. In fact, the first thing that gets pinched off is the vasculature that's going through here. So then as we look at it from the top, we get a better view of the spinal canal. And the spinal canal is this little triangular canal or tunnel that we see, that this bony protection here for the spinal cord, very important. And then we see the spinal nerves coming off here. And between the bones, as we had seen through those tunnels when we looked at it from the side view. We also have these little levers here for when the muscle attachments come to that. Now, why are we spending time on this? Because this can be very effective at releasing the pressure upon these nerves that affect how those organs react. And if they're functioning better, then we have better digestion. And if we have better digestion, then we have less parasites and things like that can form within our gastrointestinal tract, which can lead us to some of these things such as chronic fatigue syndrome. So this has very great bearing. And then what we can do is we find that the backward view here, what we're looking at is the motion of this. This is a motion unit. That's two vertebrae and this disc in between, as well as the joints here, which are the primary joint of movement within the spine. And what we can find here is that sometimes we get inflammation here that holds this not in a dislocation, but in a malposition that will then affect either the nerves off of this side or the nerves off of this side, sometimes both sides. And what we see here is we have that malposition placed in there. And so what we find is, like I said, there's the motion unit there. And sometimes it gets stuck in that form, and then what a chiropractor does is he checks and finds out just how that should be moved back in order to take pressure off the nerve in a very specific way. So then we go into different types of abnormal movement for these vertebrae. Here we have some vertebrae, and as they're stacked differently, some of these are just reacting to, now this one is a wider gap, and this is a wider gap here, so I would say that these are more towards some kind of fixation that's in there. When the gap is less of an angle than that, many times it's its normal motion in compensating for how you've been put off by one below. And so in this case, there's probably two subluxations here, and this is just tilted off to the side for the segments in between. Now you have a correct way of how these are positioned. You can have a part where it's wedged and you're putting too much pressure on the back here. And then you have a wedge here that's actually showing us that there's a problem with the spinal disc, as well as this can be a problem with the spinal disc here too, that can actually start to cause sclerosing back here and pushing back into this opening for the nerves in between. So then, Dr. Lala, we have some application of this within x-rays.
Yes, very often people with chronic fatigue syndrome do have back problems. Some of them are quite predominant, others are not. But in my years of experience of nearly 50 years of private practice, as well as an educator and well as somebody who teaches seminars to doctors of chiropractic for renewal of their licenses, find that usually there are some issues within the spine And in addition to doing a postural evaluation, doing an orthopedic and neurological workup, and making x-rays of the spine, you're coming to you have much more of an opportunity to pull things together to really find out what the cause or causes of the chronic fatigue syndrome are. And once you find the cause, you begin to know what the solution is. Now, in the United States, it's primarily a drug-oriented society. And certainly there's a lot of things about wellness care and alternative health care these days. Much of that sounds great, but as we look at a lot of those places that call themselves wellness or alternative health care, we find that it's more in name only, that when you look at what they're performing, it's this or that little thing. Much of it is of the nutrition that they're doing. Those who are advocating nutrition and diet, it's voodoo nutrition. When you look at what they're saying, there is no credible scientific evidence to an independent study to substantiate the recommendations that they're making. And my heartfelt recommendation to you is, if you're going to a chiropractor, I hope and pray to God that they've done a good examination, have been very thorough with you, and that they've made a good evaluation of your spine. And we can see in this x-ray there a curvature. And then we can look at another one here that kind of illustrates a little bit more of what Dr. Jensen was talking about, a subluxation. What you're ultimately going to see here is...
Actually, I wanted to comment about this,
okay.
because what I was
Go ahead.
talking about with all this gastrointestinal stuff is you can see right here where you have a problem with subluxations down here, and this is feeding into the gastrointestinal section. You can actually see that there's a lot more modeling here in the gastrointestinal section, as you see with somebody who has a straight spine here that doesn't have as much interference on there, that we actually find that we do see on the x-rays. Not that that's what we're looking for primarily. We're primarily looking for bone, but sometimes we see with those differences is all this modeling that's going on in here.
And that's the exact area where the nerves and blood supply goes out to the stomach, the digestive system, and the intestines.
Exactly. So what we went through before shows in application exactly what we're seeing on the x-rays, and therefore is showing us that it would be indeed a good type of treatment that would help this, that may stave off some of this chronic fatigue syndrome. Okay, Dr. Lala, you were talking about this other...
The slide that Dr. Jensen has before us now shows an illustration of some vertebra. A is a disc. B is the intervertebral foramina, where the nerves, arteries, veins, and lymphatics pass out from the spinal cord. C would be an example of a nerve passing out, and D would be a vertebra that has lost its juxtaposition with the vertebra above and the one below. So we refer to that as a chiropractic spinal subluxation. When that occurs, if it goes posterior like that backward, it impinges, puts pressure upon the nerves, arteries, veins, and lymphatics, and even acupuncture meridians that pass out of those little windows or tunnels. And then, so the chiropractor, you can palpate some of those issues with your hands, but the most scientific way to determine that is through a spinal x-ray. And I think that there's an important factor here, is to see is to know. Okay? To see is to know. To not see is to be blind. So if we don't know, we can't see. But if we see, we know. So if I don't know, I don't have x-rays in my hands. I have experience and intuition and things of that nature. I have some external tests that I can do to determine conditions, but there's nothing like an x-ray or a blood test or a urine test that can help us have